Do you know someone who's been affected by heart disease? Chances are you do. Heart disease is a major chronic illness and the leading cause of death worldwide. In the U.S., death rates for heart disease in women aged 35 to 54 appear to be on the rise. All of us are touched, either directly or indirectly, by this health issue. But heart disease also is preventable, and people who have experienced a cardiac event can take many steps to improve their health and reduce the risk of reoccurrence. One of the most cost-effective ways to achieve these goals is through cardiac rehabilitation. Cardiac rehab is a medically supervised program that helps cardiac patients improve their physical and psychosocial functioning.
Actually, the reason people go to cardiac rehab is to get their lives back. Cardiac rehab helps people have less depression, feel better, able to do more, and actually helps people live longer. People who go to cardiac rehab are anywhere between 25 and 45% more likely to be alive at 5 years compared to people who don't go to cardiac rehab. We're not quite sure why that is, but it probably has something to do with the positive changes that occur with exercise and the decrease in depression and just getting back into life again. Unfortunately, the people who don't go to cardiac rehab are the ones that are most likely to benefit from cardiac rehab. Cardiac rehab has been underprescribed and underutilized in women, in the elderly, in minorities, and these people really need to get to cardiac rehab.
Cardiac rehabilitation is evidence-based medicine with proven clinical outcomes. The programs include supervised exercise training, nutritional counseling, and management of risk factors such as lipids, blood pressure, weight, and diabetes, among other services. The work of cardiac rehab programs is supported by the collaborative efforts of healthcare providers, professional associations, community organizations, and industry. Life Systems International is an industry-leading provider of advanced patient monitoring systems. The American Association of Cardiovascular and Pulmonary Rehabilitation, or AACVPR, is a multidisciplinary professional association which provides program guidelines, continuing education, and certification. These collaborative efforts combine to work together to improve the delivery of patient care. And the results of cardiac rehab are significant. Reduced symptoms, increased exercise performance, improved quality of life, and lower risk of reoccurrence. The key outcome is the increased chance of survival, with gains of up to 46% in studies of cardiac rehab. These outcomes reduce the cost of treating heart disease by a ratio that far exceeds current insurance reimbursement rates.
In healthcare, we acknowledge that prevention is better than cure, and what I'm talking about there is it does cost less if we take the time to prevent an event. However, in the past 20 years, the emphasis in healthcare has been more focused on a cure it or fix it mentality rather than prevention. But it's never too late for prevention. And this is what we do in cardiac rehab. Cardiac rehab is a secondary prevention. And even though patients already have had a heart attack or bypass surgery or an event, the things that they can do as well as we can help them do can make a big difference in the rest of their life, whether it's in quality of life as well as prevention of future events, reduce the chance of dying from event prematurely. And those things include taking the appropriate medications, lifestyle interventions. I'm talking about physical activity, smoking cessation, stress management, losing weight. The most important thing, though, when we're talking about prevention is it can't be a quick fix. It's for the rest of their lives.
Despite the positive outcomes, cardiac rehabilitation is an underutilized service following medical events such as myocardial infarction, coronary artery bypass surgery, angioplasty or stent, transplantation, and heart failure. Only 15% to 40% of patients who are eligible for cardiac rehabilitation receive a physician referral. This gap in care is especially large for women, who are referred to cardiac rehab less often than men.
To increase the use of cardiac rehab, we have to address the misconceptions of what it is. Medical therapy, medications are essential components of cardiac care, but they're insufficient to be able to change your lifestyle to be able to live longer and healthier. And that's what cardiac rehab is all about. To be able to merge the two, the medical therapy, the medications, and the lifestyle interventions to reach the best that you can be in your heart health. So that's one thing. The second thing is to reduce the barriers to utilization, to using cardiac rehab, especially among those populations that find it more difficult. And I'm talking about women, I'm talking about the elderly, I'm talking about the minority population. They have other barriers. I'm talking about transportation, cost, convenience. So we as cardiac rehab professionals need to be more innovative and creative to make sure we include options that include these populations.
Life Systems International and the American Association of Cardiovascular and Pulmonary Rehabilitation represent clinical leaders and industry that bring the life-enhancing and life-saving process of cardiac rehab to more patients. LSI's technological advancements allow cardiac rehab programs to treat more patients and operate more efficiently while improving clinical outcomes. LSI works with cardiac rehab centers to improve patient care with technology to monitor exercise systems, chart data, track patient progress, and more. The AACVPR serves as the unified voice of multidisciplinary health professionals and programs, raising awareness for the need for cardiac rehabilitation and the evidence supporting its use, providing best practice guidelines and certification for quality programs.
The challenge of any patient monitoring company is to implement technology without impeding on the patient care process. At LSI, we achieve this by listening to our customers ahead of time and automating the features that they want from our technology into their patient care process. This allows our clinicians to be out on the floor, on the patient care floor, treating patients and their symptoms, not necessarily tied down in front of our machine. Our advanced arrhythmia detection is going to let the clinician know if there's a problem with a patient, and they can take the appropriate actions at that time. So really at LSI, what we're trying to do is streamline the patient process, easy to use software, and keeping the clinician on the floor with the patient where they need to be to deliver the best patient care.
After my second heart attack, I was very depressed. It's kind of like you don't even look forward to living any longer. Now that I have come to HeartPath and I'm doing my exercises, I went to a nutrition class, I'm eating better, I feel so much better, my body even feels better. So I look forward to getting up every morning and living a full and plentiful life.
To learn more about Life Systems International, call 800-846-1279 or visit the company online at www.lsi-medical.com. To learn more about AACVPR and to find cardiac rehabilitation programs near you, visit their website at www.accvpr.org.